Let me ask for a friend. Is 5 centimeters considered small? Guys never ask this out loud, but they all Google it at 2 a.m. Here's the truth. Large clinical reviews, tens of thousands of men measured around the world, show that the average length is around 9 centimeters when soft and around 13 centimeters when fully erect. That's global data across different regions. Soft length tends to vary a lot. Erect length is usually more consistent. In other words, what you look like relaxed is not a reliable way to compare yourself to anyone. Different regions do show differences. In some data sets, South America tends to run longer in the soft state, around 11 centimeters on average. East Asia tends to be shorter in the soft state, around 7 centimeters. But once erect, the gap shrinks. Average in places like Australia and New Zealand can hit around 15 plus centimeters, while East Asian samples tend to be closer to about 12. So yeah, 5 centimeters soft is below most published soft averages, but that's not the real question. The real question is, did you even measure it right? Because most guys measure in a totally wrong way. Here's how doctors do it in studies. Step 1. You stand or lie back in a neutral position. Step 2. You measure from the top side, not the underside, from the top. And this part matters. You press the 0 point of the ruler firmly back against the pubic bone, not just against the skin. Why? Because there's a fat pad there. That pad can be thick if you're heavier, thinner if you're leaner. If you don't compress the fat pad, you're basically just measuring however much is sticking out today, not what's actually there. Clinically, they measure what's called bone pressed length. That's the number used in research. That's the number you should compare to charts. Anything else is just lying to yourself, or lying to someone else. Now, let's say you measure correctly. You're still soft. You're still short. You're panicking. Before you freak out, listen to this part very carefully, because nobody tells men this in a normal way. Most guys grow a lot from soft to hard. There's even slang for it, the grower. In huge population sets, we're talking tens of thousands of men, average increase from soft to erect is roughly 50%. Example, 10 centimeters soft becomes around 15 erect, 12 soft becomes around 18 erect. But some guys grow even more than that. Some men look very small at rest and then nearly double in length with full erection. That is normal. That is extremely common. That is not a defect. There are even reports, especially in some Asian male cohorts, that the growth ratio from soft to erect can be 60, 70% or more. That doesn't mean you're broken if you don't do that. It means judging yourself based on how you look in the locker room when you're relaxed is meaningless biology-wise and honestly cruel psychologically. There's another thing almost no one explains, hidden length. Some of what you think is small is literally just buried in lower belly fat. Extra belly fat creates a pad above the base. That pad physically swallows visible length. So even if you and someone leaner have the exact same bone press length, you will look shorter just because more shaft is hidden. This is also why a lot of guys notice, I lost some weight and suddenly I look longer. It's not magic, it's anatomy. And yes, for bigger guys, the fat pad can also get in the way physically with a partner. Less padding equals less distance between bodies equals more effective depth without changing your biology at all. So first lever, body fat. That's the boring, unsexy answer, but it's very real. Now we need to talk about devices, because this part gets abused online. There is something called traction therapy. It's not a pill. It's not a sketchy pump in a gas station bathroom. It's a mechanical stretching device used in urology. You basically attach a gentle tension device and keep mild, constant pull for hours per day for months. Clinical studies in men who are already fully developed have found that consistent traction, we're talking like 4 hours a day over 6 months, can lead to increases of a couple centimeters in the relaxed flaccid length. That is real. That is published. But it's uncomfortable. It's slow. And it only works if you are consistent like a maniac. 4 hours a day of anything strapped to you is not fun. And this is critical. You do not try this if you're still developing. If you're under 16, under 18, still in puberty, your job is not hack growth. Your job is finish normal development safely. So if you're still going through puberty and you're extremely anxious about being behind your classmates, here's what actually matters. enough protein, enough vitamin D, enough sleep, resistance training for the lower body, squats, deadlifts, cycling, running, because overall, testosterone and circulation matter. Also, heat control. Your genitals hate overheating, long hot soaking, super tight underwear, laptop on lap heat for hours. All of those can mess with normal testicular function and hormone environment. You want breathable support, not constant squeeze plus sauna. Now we have to talk surgery. Yes, there are surgeries that claim to make it longer. One common one is called suspensory ligament release. There's a ligament that anchors the base internally. A surgeon can cut or loosen that ligament so more of the internal portion hangs externally. On paper, that makes it look longer when soft. In reality, 1, it's usually only a couple extra centimeters. 2, the angle when erect can drop, meaning you might technically be harder, but the angle points lower, and it can feel less stable. Not fun if you actually care about function, not just ruler pictures. There are also filler procedures, injecting gels or fat to make it look thicker. Those come with risk: lumps, scar tissue, infection, asymmetry. Ask any honest urologist. These are not casual lunch break upgrades. They are real medical procedures with real complication rates. So if you're thinking, I'll just buy a new body with surgery, slow down and ask the only question that matters. Is this a medical issue? Or is this anxiety and shame? Because there is such a thing as a true medical condition. True micropenis. It's rare. It's usually diagnosed in childhood. It's linked to specific hormonal patterns, not, I feel small in a gym shower. If you suspect a developmental disorder, you should absolutely see a qualified clinician. But if you're within normal stats and you just hate yourself because of comparison culture and memes, you deserve to hear this clearly. You're not broken. Let me say one more thing for the guys who are dying of embarrassment, never told anyone, never even asked a doctor because they're sure they'll be laughed at. Size is not the only thing that matters in actual intimacy. Blood flow, stamina, confidence, communication, emotional safety, knowing your partner's body, being present instead of panicking about yourself, those matter way more for real satisfaction than the exact number on a ruler. If no one ever said that to you before, I'll say it here. And now, the serious red flag section. If you suddenly lose length, if you suddenly can't get or keep an erection, if you have pain, curvature that's getting worse, or you notice one testicle feels different, heavier, or hotter, that's not, haha, I'm small. That's, please go see a urologist. That can be blood flow problems. It can be hormone issues. It can be inflammatory tissue changes. And in rare cases, it can be cancer. That is not a thing you fix with bro science on the internet. Here's how I want you to leave this video. Number 1, measure the medical way, bone pressed. Don't lie to yourself. Number 2, if you carry a lot of belly fat, understand that visually small very often means hidden, not missing. Number 3, if you're still going through puberty, your priority is nutrition, sleep, and not overheating the equipment, not panic buying weird stuff online. Number 4, traction devices exist, but they're long, boring, medical, and not for minors. Number 5, surgery is real, but it's not casual, and it can trade stability for appearance. And number 6, if you have sudden changes, pain, or your testicles don't feel right, please talk to a clinician. That's not weakness. That's just being smart with your own body. This is educational, not personal medical advice. But I really, really hope it killed some of the shame. If nobody ever explained this to you before, drop an anonymous comment and just say, heard, and subscribe to Vital Proof. We talk about the stuff you're actually scared to ask.